Blixx, all about horses and their care, where our motto is companionship, care, and commitment. I'm your host, Gabriela Rodriguez, and today our show is going to focus on Eastern equine encephalitis, which is a mouthful. I'll say it again. So it's Eastern equine encephalitis. So when most people hear the warnings in the media about encephalitis in the summertime, they get concerned. But if you're a horse owner, you should be concerned and understand that it's a very serious problem, and your horse could die. Not only can your horse die, but there's some very serious physical symptoms and neurological symptoms as well. Today we have our guest, Dr. Donald Honig, who's going to talk to us about EEE, or Eastern encephalitis, and he's going to talk to us a little bit more about what we can do to prevent this disease as horse owners, because it's, again, very serious. A horse could die. And if you don't call your vet because you didn't recognize the symptoms, your horse could really suffer. So I'm going to introduce to you our guest today, Dr. Donald Honig, retired Maine State vet and current extension veterinarian for the University of Maine. Thank you for coming on our show, Dr. Honig.
Good morning. You're welcome.
Can you give us a little information about your background, how you became the Maine State veterinarian?
Sure. I went to veterinary school at the University of Pennsylvania in Philadelphia and graduated in 1978, went into private mixed animal practice in Massachusetts for a few years. And I was ready for a change from mixed animal practice and was exploring some options and discovered that the U.S. Department of Agriculture had an opening in Maine. And so I signed up with the U.S. Department of Agriculture as a field veterinarian for 5 years in the early 80s. And then I made a switch to the state in the mid-80s when the USDA was putting some pressure on to transfer me into management positions, which I really wasn't interested in at the time, and joined the state of Maine in the mid-80s as a state field veterinarian, and then became the state veterinarian in the mid-90s. So I retired in the summer of 2012, 2 years ago, and accepted a congressional fellowship in Washington, D.C. in Senator Susan Collins' office, and I worked down there for a year on farm policy and dairy policy, public health, a bunch of different issues, and it was a fascinating experience, but it was good to get back to Maine last summer. Mm-hmm. And then I started working for Extension in January, part-time, and I also work for the American Humane Association part-time as their chief veterinary advisor for their farm animal welfare program. So I'm back to work full-time again.
Yeah, so you're enjoying your current position with the extension, something a little bit different than being the state vet and being in that hot seat, I bet.
Yeah, it is. It's actually a bit of a relief. I was ready. You know, I'd felt like after my career with the state, I worked for the state for 26 years, that I was ready for a change, and I was eligible to retire at that point, but I wasn't ready to stop working. So the fellowship was a nice transition into a new phase of my career. Yeah. So I'm reinventing myself a little bit, but I love the extension work. I love going out and talking to farmers on a one-on-one basis. So I'm doing that again, doing things like this, educational programming, yeah, and doing some meetings.
And continuing your education, because we all learn,
yeah,
right?
Absolutely, for sure, and especially with the American Humane part of my job now, I'm really getting deeply involved in farm animal welfare, and that
That's
program
wonderful.
is a voluntary program. So
the animals need you, and the people need you too.
Hopefully, yeah. So yeah, it's a great change for me, and one of the good things about it is I don't really need to supervise people or manage programs anymore. So
and that must be nice.
I spend more time on just issues that I really like and working with farmers.
Yeah.
So, yeah.
Yeah. So, and one of my questions is, I am a horse owner, and so like a lot of people that have horses, we've heard all the warnings like we always do in the summers, and they're important to heed. Today's October 3rd. We've had some cool nights. It's cooling off in Maine, I guess. But my question is the danger really over?
It's not. We have told people in the past with respect to triple E, which is probably the easiest way to say it.
Yes.
Um,
EEE or
yeah,
triple E.
yeah. We
That
always
was a
say
hard.
triple E, and that you really can't let down your guard until the first hard frost.
Mhm.
And even then, I think it's not 100%. We've had a couple of very, very mild frosts where I live in mid-coast. I live in Belfast.
Okay.
I don't think we've had a frost down here yet in southern Maine.
No frost in
And
southern
so,
Maine. No.
if I go out on a warm day, and I guess it was really warm here last weekend, I wasn't
Yes.
around, but there are mosquitoes out still.
Yep.
And there will be until we get a really hard killing frost. And that varies depending upon the part of the state you live in. Down in
Mhm.
southern Maine, it'll be much later than it is in some areas of northern Maine, central Maine, where they've already had some killing frosts.
Yeah.
So, they've had temps down in the high 20s and low 30s
Right.
2 or 3 weeks ago.
Right. But
So,
even then, I learned from Kathy Murray, who was on our
right.
show, that the sun just warms them up.
Yeah, it does.
And they may be dormant for a little while, but once the sun
Yeah.
comes out, they come out with it.
They're out again,
Yeah,
too.
they like
Yeah.
it just like we do. So
Yeah,
can
go
you
ahead.
tell us, can you first tell everyone what encephalitis means? It's swelling of the brain, inflammation in the brain,
Yep.
but that's why there are also neurological problems that occur with horses. But can you give us a little bit more information on Eastern equine encephalitis and why it's called Eastern as opposed to Western
Yeah.
equine encephalitis? It's two different things.
Yeah,
Okay.
they are. They're similar viruses. They're called arboviruses, arthropod-borne, which means insect-borne, ARBO.
Okay. Thank
But
you.
they are they're very similar genetically. They're just geographically separated.
Okay,
So the
very
western,
important for
yeah,
us
western
to know.
is in west of the Mississippi. Eastern is east of the Mississippi.
Okay,
And so our main concern is eastern. So equine means it can affect horses. Encephalitis means, as you said, swelling of the brain and associated spinal cord and so forth. So for some reason, this virus has developed an affinity for the central nervous system. So when you are infected with it, it likes nervous tissue. It
Okay.
likes the brain,
Yeah.
and it can replicate or reproduce there rather rapidly.
Okay.
And so, from the time an animal or a person is actually bitten by an infected mosquito to the time that they show clinical signs is usually within 5 days or so. I mean, it can be sooner, it can be a
Sure.
little bit longer. It's variable, and then those signs would, in a horse, could progress from a fever to just not acting right, lethargy, depression,
Yeah.
to unstable gait, circling sometimes, instability.
And that's a huge red flag.
It is.
Huge.
So
That's
stumbling.
not colic.
No, it's not. And they just look like they have I've seen a number of these horses, and they look
eyes.
like they have a really bad headache, and they probably do. Of course, they
Okay.
can't tell us.
Right, right.
So we've got to look at what their signs are.
Right.
And then ultimately they will go down and sometimes go into seizures
Yeah.
and
Which hopefully we can avoid.
eventually coma and death. So the mortality in horses from this particular disease is very high. It can approach 90%.
Yeah.
Um,
Can I just ask one
Yeah,
more
sure.
question? I'm sorry to interrupt,
It's
but
all right.
I want to make sure that people that live in Maine, because it's called Eastern equine encephalitis, if they're going to move down to Connecticut, that they feel that they're going to be a little bit safer. That's not true because it encompasses the entire eastern part of the United States. So
Yeah,
if
it
they're in
does.
Virginia, in Florida, any of the states in this half of the country,
Exactly.
you can be in big trouble with.
The risk is higher the further south that you would go.
Yeah.
And if you look at historically triple E in Maine, I worked here in Maine from 1983 until 2005 before I remember a case of triple E in Maine.
Mm-hmm.
And then we had I believe two cases in 2 or 3 in southern Maine, very southern Maine, Berwick and Kittery.
Yeah.
And it was surprising that we had it, because we knew they had it in Massachusetts. They'd had some cases
Right.
in New Hampshire,
Yeah.
but we hadn't had a case here, and people said since the early 70s. So, but
Sometimes Mainers feel safer
yeah,
because they're up here, but things eventually
no,
head
and
this way.
that was the first couple of cases in horses that we saw, and then we had, I believe, one case in 2008, and then we had a real explosion in 2009
Yeah.
when we had a very wet summer,
Yeah.
very wet May and June in 2009, and we had 15 horses die of it, one
That's
llama,
unbelievable.
and
Yeah.
3 pheasant flocks. So we had a big upsurge in it. The other thing that was surprising about 2009 was that the disease first showed up in Waldo County, or southern Penobscot, I think. So it made a big geographic jump from southern York County to
All the way
Waldo
up.
County, and that's where the most of the focus of the infection was in 2009. I think we had 5 horses in Unity, a couple in surrounding towns. We also had a couple more down in this area, but the surprising thing was this geographic jump it made,
Right.
100, 150 miles from where it had been to where it showed up there.
Yeah, and where you would, or I would think, as a horse owner or someone that lives here in Maine, that it wouldn't travel up that way because up further north, the temperature should be a little bit lower. And I want to talk about all this a little bit more.
Sure.
But first, I wanted to just talk a little bit about people. And I always sort of try to bring the other companion animals into the picture, dogs. Just out of curiosity, though, this does affect people, but not as much as horses. And I was reading a little bit about dogs, and it seems that they don't tend to have that problem, although they get heartworm perhaps from
Right.
mosquitoes. They don't get, they can
Yeah.
possibly, and maybe there's more than we know of.
Yeah.
But any animal or mammal that lives outside could possibly be infected by this. Maybe we don't have as much information as we should have.
Sure.
But the biggest, the animals that's most affected are the horses.
Yep.
Why is that?
Who knows? That's a good question. I think there's some evidence that dogs and cats can be infected through blood testing. If you test a bunch of dogs and then you test for triple E,
Yeah.
you probably find some that have antibodies to it, which means that they've been exposed to it. But they apparently generally don't show signs of it. Same thing with cats. Whereas with horses and people, if we get bitten by an infected mosquito, people in particular, we can show anything from almost no signs, maybe mild fever-like signs. You might not feel right for a day or two and then get better, and you might not even think that you had anything other than maybe you ate something,
Right.
to really severe neurologic signs, to death in people.
Yeah.
About a third of the people who get triple E die from it. Unfortunately, a woman died here in New Hampshire last week, I think.
Yeah.
We have, I don't think we've had a human case that was a person who was infected in Maine. There was a person who died in 2000, a few years ago, who was diagnosed here, but apparently they felt was infected in one of the other New England states. So, it's a very serious illness in people. If you do survive and you've had neurologic signs, central nervous system signs from the disease, oftentimes those will persist for a very, very long time, if not for your
Years,
lifetime.
yeah.
So
you're never the same. That's very serious. Yeah.
And so
Okay. So how do we get EEE or triple E?
Sure.
Who's the culprit? What's the culprit?
the culprit appears to be wild birds.
There it is on the screen.
There you go, mosquitoes.
that's a mosquito.
And exactly. So we haven't even mentioned the mosquito yet, have we?
No.
So there we go.
It's important for people to understand that
Sure.
this is what causes
Yeah.
it, not a bacteria.
Nope, it's a virus, and it cycles from wild birds through mosquitoes back to wild birds. In Maine, Kathy probably talked about how many mosquito species we have in Maine. It's somewhere around mid-40s
I
to
think she said 48.
48.
I was amazed.
Yeah,
I didn't know
and
there were that
I
many.
think that at least 10 to 14 of them can transmit
That's a
this
lot.
disease.
Yeah.
But there are certain mosquitoes that are well known for transmitting the
Mm-hmm.
disease. One of them is called Culicida melanura, which is a mouthful, but they tend to live in red maple swamps, in swampy areas, and there are
That's
a lot of
really
red
good
maple swamps
information.
around
Yeah.
here. Just look around you right now and
Well,
look
to
at the
be
trees
honest,
that are.
I don't know what red maple swamps are, but I'm going to go look
Well,
so
if you
I can
look at
acquaint myself.
a lot of the trees that are in color right now,
Okay.
a lot of them are maples, and
Okay.
many of them are red
The
maples.
red
Yeah.
maples.
In
Okay.
fact, one of the cases that when we went down to a
Interesting.
farm in, I think it was North Berwick,
Mm-hmm.
or down in that area in 2008, we visited a farm where a horse had died, and they were
Yeah.
right on the edge of a red maple
Wow.
swamp. So that's where this particular variety of mosquito is known to hang out.
Yep.
And so what that mosquito can do, it's called a bridge vector, which means that normally it wants to bite birds, but it doesn't mind biting people and horses.
Okay.
So it will bridge from biting a bird and getting the virus, and then bite a human being. Doesn't have much preference,
Okay.
or a horse.
Okay, I had, let me just interrupt you again before I forget this thought, but the dead end vectors,
Yeah,
when I was doing a little bit of research,
dead end host.
oh, excuse me, dead end
Yep.
hosts, that's what I meant.
Yeah.
So dead end hosts would be horses.
Yeah.
The primary hosts are the birds.
Right.
And birds include emus. I had to look up an emu because I didn't know
Yeah.
what an emu was.
Right.
But an emu is actually a bird.
Yes.
So that may make us feel a little bit safer, but we shouldn't feel that we're not going to have that problem with our horses just because
Yeah.
they go after the birds first.
They may, but the dead end host refers to the fact that if a horse is infected, the virus doesn't replicate enough in the horse to be transmitted to another mosquito if it's bitten by another mosquito.
Okay,
So
that's important
that's what it
information.
means. So that an infected horse will generally not have enough virus in its bloodstream to be capable of infecting another mosquito.
Okay,
Nor can it pass directly horse to horse.
okay.
So an infected
And that's
horse will
important.
not transmit to another horse.
Okay.
Okay? So another horse, even if it was on that farm, would not, let's say there was a farm with a triple E infected horse, that triple E infected horse would not pass it to another horse. Another horse could be infected, but it would have to be bitten by an infected mosquito.
Okay.
Same thing with people. People are what's called dead end hosts too. We
Yeah.
don't replicate the virus in our bloodstream, but it does replicate in our central nervous system. So that's where the virus, as I said before, likes to, for some reason, it likes nervous tissue.
Okay.
And so
Is there-
transmission is just by mosquitoes. There's one caveat to that, in that pheasants, we had 3 pheasant flocks infected in 2009. They can practice cannibalism. A lot of birds, chickens, pheasants, so
Oh,
forth,
right.
will be cannibalistic.
heard
So
that.
if they come across a member of their flock that's weaker, they will start pecking at it.
Okay.
And there can be bird-to-bird transmission there because of that type of behavior. So.
Okay, okay. I'm just curious, just something that I thought of right now. Have they done any testing to see if mice are infected by triple E, if they have
I'm not
that
sure, but
virus?
I don't think they're an important reservoir host like wild
Okay.
birds are.
Okay.
The other thing is, before we let the thing go, emus, we did have some infected emus this year in southern Maine.
Yeah.
And people who own emus apparently are using the equine vaccine in emus.
Okay.
So there's some information out there on that. I don't.
Okay,
You know, I
and
don't-
that's okay to do,
Yeah,
to
I
use
don't
the
profess
equine
to know
vaccine?
it, but there are.
Okay.
If you have emus and you're interested in vaccinating, you should talk
Okay.
to your veterinarian.
Okay. Now that brings me to another point. Should a person use
No.
the horse vaccine?
No.
And I think I heard the director of the CDC, Sheila Panett.
Yeah.
I think she gave some warnings to people not to use the horse vaccine.
Don't do that.
Yeah, don't do that
Yeah.
because it could really make you sick. That's not something that you want to do. So horses can't give it to horses. If someone's in the barn and a horse gives a little nip to someone, they can't get it. The only way is through that mosquito.
Right.
Okay.
Right.
So that should make people feel a little bit safer. Okay.
Right.
So signs and symptoms, we talked about that already.
Yeah.
But it's a very serious disease. It progresses very quickly. And
It
so
does.
it's important for horse owners to be vigilant, as
Yeah.
they should be anyway.
Yeah.
And because the horse could really suffer,
Yeah.
not only the physical symptoms, which I'm assuming can be very painful, but the neurological symptoms
Yeah.
have to just be so well, I won't use the word frightening, but certainly it could cause a lot of anxiety, and you don't want to see any animal suffering like that.
No, we don't. And as I said, I saw a number of animals in 2009 that were affected with this, and most of them were kind of at the end of the progression of the disease.
That's too bad.
So, and all of them had to be euthanized. So,
Can
yeah.
can you give us a little bit of information? If someone sees their horse and their horse, we don't want anybody to panic, certainly, but you want to be educated, which is why you're here. But we have a lot of things that happen to horses, unfortunately, quite regularly, like colic. Sometimes horses founder. Tell us what is different from this.
Well, I think
That
with
should be a
colic,
sign.
generally horses are off their feed. They kick at their belly, they get down and roll. They do some active things that horses with central nervous system signs do not do. Okay, and so they're just uncomfortable. And
Or lethargic. Sometimes the
yeah,
horse
they
will
can
just be.
they can be lethargic, but there's a big difference between a horse with colic and a horse with
Okay.
neurologic signs, because they will stumble, they'll circle, they'll be unsteady on their feet. Ultimately, they won't be able to walk properly. Whereas with horses with colic, generally one of the things you recommend people do is walk their horses to try to get their guts moving again, and they'll walk fine.
Yeah.
They can walk fine. They
Yeah.
don't refuse to move. Whereas horses with triple E, as they progress, and it progresses pretty quickly, they won't be able to walk.
Okay.
They'll stumble, they'll circle, they'll fall. So there's a big difference. And
Now, that would be
the,
awful.
the other thing that's important to mention is that oftentimes with central nervous system diseases, it's impossible to distinguish between some diseases which cause central nervous system signs, the most important one in Maine being rabies. So pretty much every time we've had a horse that has been ultimately diagnosed with triple E, we always recommend that the owners get the horse, if the horse dies,
Yeah.
the horse tested for rabies. Now, unfortunately, that involves a very, very upsetting process of having to remove the horse's head.
Yeah.
And a lot of times, sometimes owners do not want to do that. There are other ways to get samples, but in order to diagnose rabies and rule out rabies, because rabies is a legitimate big public health concern that can be transmitted by bites and body fluids, which is why we want to rule it out. So we always try to convince owners to get if they're in the unfortunate situation of having to euthanize their horse with central nervous system signs, we always recommend that they get the horse tested for rabies.
Yeah.
If not, we have to give them all sorts of warnings about the fact that, well, we don't really know that this isn't rabies, it might be triple E.
Well, you want to make sure.
Yeah.
So you have the right statistics.
Right. The good thing about diagnosis for triple E is that we can, sometimes we can run a blood test that will be, that'll tell us something, but the best tissue is nervous tissue, and so we need to get that neurologic tissue for testing.
Right. There's one thing that you and I talked about right before the show, and it's something that I didn't know, was that horses can be exposed to this virus or any virus, or we can be exposed to any virus as mammals, right? But you don't necessarily get the full-blown disease.
Sure.
So that's a possibility too. And I don't know if the viewers are seeing the horse that's on the screen right now, but I just wanted to give people an idea, especially people that don't have horses and have never really been around a horse, how big they are and how vulnerable they are to bites. And if you spray a horse, you can't spray every tissue. It's not
Right.
good to spray every tissue, so you can't protect them that way. If you cover them, you can't cover everything. So there's lots of ways that we can reduce the exposure, but there are a lot of places. I've looked at my horses sometimes, and underneath their bellies, of course, in the places where they can't reach, I have seen not one or two, but many mosquitoes in
Sure.
some of these places where I have boarded my horses
Yeah.
before, and I've been absolutely frantic because they're not showing any sign, they're not acting uncomfortable, they can't talk.
Right.
But that's something that even horse owners need to understand. Just because you're looking at your horse and your horse looks comfortable, it doesn't necessarily mean that something isn't happening. So you have
Right.
to take a good look and make sure that you're taking care of your horse. Do you want to talk a little bit about the statistics about when Triple E first was found here in Maine? That was in 2005,
Right.
right? Okay. So give us the progression to 2014, where we are today.
Sure. Well, I think we had 2 or 3 horses in '05, believe 1 in '08, 15 in '09. I know we had 3 last year, 3 horses die last year. And I don't think we've had any yet this year, although we did have the emu flock.
Okay. But that's a
or
bird,
emu,
right?
Yeah,
Yeah.
right. But it's just indicative of Triple E being in the area. The Maine Medical Center Vector-Borne Disease Lab and some entomologists have been testing mosquito pools, meaning they trap mosquitoes and then they take them to the lab in South Portland. And
So
they've
can you give
done
me,
it
how many mosquitoes do they trap? Hundreds?
hundreds.
Hundreds.
Yeah.
Okay.
Yeah. And so they will take them into the laboratory and test them for Triple E and West Nile virus. And
Okay.
so this year we've had a number of instances in southern Maine, York County, where they've had positive mosquito pools, meaning that when they tested the actual mosquitoes, they found the virus in the mosquitoes.
Okay.
So that's kind of a sentinel type situation where you know it's in the mosquitoes now, and we just urge people to be more alert. And you can do things like just eliminate all standing water in your on your property. Cut back the brush. If you can
Mow the paddock.
Yeah, and I mean there are premises sprays that you can use. There are multiple different
of
sprays
things.
that you can use on your horses. There are, head nets and
But
things
still,
like that.
we talked about, it doesn't cover every single area.
It doesn't.
It's impossible.
And so, but there are things you can do even time of day.
Yes.
You can keep your horses in the dusk and dawn, which is when a lot of these mosquitoes are most active. But the most important thing you can do is vaccinate your animals. And I know people are probably saying, when is he going to get the vaccination? And so we've touched on that now, and there are effective vaccines available. Of course, with any vaccination, nothing is 100%.
Okay, that was going to be a question.
But I can tell you that in the case of the 2009 outbreak, with 15 horses, many of those horses had not been vaccinated, and there were none that were up to date on their vaccinations. They might have been vaccinated in a previous year or years, but they hadn't been boosted that year.
Okay, but we don't have information. We don't have, and I'm just trying to get, I like to have a lot of information. So it doesn't seem that we have a lot of information on the ages of the horses and how long, say if a horse was 15 years old, if they had been vaccinated yearly until they were 14 and then not vaccinated for 2 years. We don't have that type of really specific information.
Yeah, and I think the reason is because when somebody loses their horse, it's a very upsetting time for them, as you can imagine.
I've been through it.
And you've been through it. And so we try not to pry a lot into getting that type of detail.
Yeah.
I mean, the most invasive question that we ask is, was the horse vaccinated?
Vaccinate.
And
Yeah.
even that can be an embarrassing question because the people feel guilty for not keeping their horse up to date
But
on their
hopefully then they
vaccination.
learn
Well,
and we
and
don't
here
do it
again,
again
we hope so.
or
And so I think what
something
happened
different.
with in 2005 was that was a bit of a wake-up call to
Mm-hmm.
horse owners in Maine that, oh, Triple E is in southern Maine.
Mm-hmm.
But I don't think people really got it in 2009 when we had 15 horses
I want
die
to talk about
within
that a little
6
bit.
weeks.
Why did we have 15 horses? That is just incredible.
Yeah,
That 15 horses died.
I think there were probably a number of factors that contributed to that. Number one, we had a very, very wet
Okay.
spring.
Yeah, you
In
said
May and
that.
June, we had just torrential rains
Mm-hmm.
throughout those couple of months. So it was a summer when the opportunities for mosquitoes to breed were just everywhere. So
Okay.
standing water everywhere.
Yeah.
We probably had a situation where the horse population wasn't as well protected as it should have been. As I said, I think people had gotten complacent with their Triple E vaccinations over the years because we hadn't really had too much of it. It hadn't been in the media too
Mm-hmm.
much. And who knows about the bird situation?
Right.
Because that was probably what transferred it up into Waldo County
Right.
from here. But I think the primary factor was probably the wet spring that year.
Right.
That
Well, let me
contributed to
ask you,
mosquito numbers.
this July, we had a lot of rain in
Yeah, we
July.
did.
This is 2014, and I was noticing that when the deaths occur, they're typically in September, and what I understand about that is that there's just more mosquitoes and there's more infected mosquitoes, and so
Yeah.
that's why you see more of this in September than you do in June or July, at least here in Maine.
Yeah.
Is that right?
That
Okay.
is.
So we had a whole lot of rain in July. I'm very fortunate. My property has really good drainage. That's one thing about my property that I'm happy about.
Yeah.
But it's October now. Should we be seeing some reports or hearing, if some horses have been infected by Triple E? That's of course to say, and this is a whole nother topic, if people are calling their vets, because I'm assuming that there are horses that unfortunately never see a vet, and horses that maybe just die and no one ever knows
Yeah.
that they died or what they died of. So
I think this is
what do you think is going to happen this year?
well, I don't know. It's very hard to predict. I mean, this is a dramatic enough disease in the horse. It's upsetting to owners to see their horse stumbling around and seizuring and so forth. So a lot of times, I would say in the majority of times, people call their veterinarian. And so ultimately we'll get a report, the state will get a report of it as
Yeah.
a reportable disease. But it's very hard to predict. I mean, we've had somewhat of a wet summer. The past month or so has
Yeah.
been fairly dry. But when the 2009 outbreak started in August 4th or 5th, so very early.
Right.
You know, the previous 08 and 05, we'd seen cases in September. So this was not only early, but it had made that geographic jump. And here again, I think the answer was the weather.
Yeah.
Now, it could be, hopefully, that the message has gotten out there to the horse community.
And we're helping.
That we have Triple E here.
Yeah.
I mean, this is, we've become a fairly high-risk state for it, particularly, I would say, from, the Bangor area down. So I hope the message has gotten out to horse owners to keep your horses up to date on their Triple E
Right.
vaccination.
And I want to just interrupt you again one
Sure.
time, because we talked about this before and I found it a little bit startling, but I think it was I think it was 2013, but I'm not sure, that one horse died and was up to date on their vaccinations. So sometimes something
You
like
just never
that
know.
happens. There's
Yeah.
also a veterinarian here in southern Maine that advocates that people do their vaccinations after April 1st, because it seems to be a little bit safer. If you're going to vaccinate, don't do it in March or February. Do it after April
Yep.
1st because then it's going to last longer into September and October. Is that
Right.
right?
Yes, that's probably really good advice. And
Mm-hmm.
in fact, in some states where this is triple E is seen a lot more often, like Florida, in
Right.
those states, some veterinarians
Glad we're not there.
recommend vaccinating up to 3 times a year.
Yeah, that.
But
Yeah.
the idea behind vaccinating after April 1st is that
Mm-hmm.
the duration of immunity for this vaccine will hopefully carry you through the mosquito season, which we hope ends in October. And
Yeah.
because this is a killed vaccine, um, the
Oh, that's
immunity
another
to
good
it
point. Okay.
it's
Not a live
a virus
virus.
that's been inactivated,
Okay.
killed,
Okay.
and so oftentimes the duration of immunity of some of those killed vaccines is not as long as for live virus
Okay.
vaccines where it
But it's
stimulates more
safer,
immunity.
from
Well,
what I
I think
understand, the
they're
killed
all
vaccine.
safe,
Okay.
but they're all safe. They've
Yep.
been proven safe
Mm-hmm.
um, and effective, but a killed vaccine just doesn't stimulate the kind of immunity that a modified
Oh,
live virus vaccine
right.
does. So therefore, the
Okay.
recommendation is to, well, the recommendation is consult with your veterinarian because
Okay.
I'm not in a position to be the veterinarian for every horse in
Right.
Maine. But so we always, we always put that caveat in there that you should talk to your own veterinarian. But
Yes.
in general, the recommendation from the manufacturers and from us at Extension is
Mm-hmm.
to vaccinate at least annually,
Mm-hmm.
and vaccinating after April is probably a good
Okay.
idea.
And one of these days we'll have a show on vaccination and talk a little bit more
Yeah,
about that.
that would be
But
great.
I see a picture up on the screen, and one thing I really want to talk about is prevention and lowering the exposure. And one
Yep.
thing we've touched upon already a little bit was vaccination. But I have a picture here, and that's somebody's property. And we were talking about water,
Yeah.
drainage. It doesn't have to be a huge puddle, right?
No, it
Right
doesn't.
there, I see 4 or 5 different things on the ground. There's a little bit of water on that mat
Yeah.
that could foreseeably last. If it was in the summertime, it could last several days and it could
Yeah.
start breeding mosquitoes. There's some plastic containers. There's a big container where the hose is, and there also is a big tub, that blue tub, but
Right.
the rim of that tub holds water,
Yeah.
does it not? And so technically speaking, mosquitoes could produce in all those places, right?
Yeah, they can. I think you can drive yourself crazy in trying to eliminate
Well,
standing water.
I'm good at that.
Yeah,
And
but
I try.
and if you want to do an interesting, little science experiment, just leave a 5-gallon bucket half full of rainwater out
Okay.
for a week or so, and then go look in it, and you can actually see the mosquito larvae
Uh-huh.
swimming around in it. So it doesn't take that long for the
Right.
time when they lay the eggs on the edge of the water to those larvae start swimming,
Right.
and then they go through another. I'm sure Kathy talked about it, is much more expert on it than I am, but they go through a transition into the stage when they can fly, so they can come to the surface of the water and then fly. But so I think the point is to eliminate the biggest areas of standing water, which are usually tubs.
There's another picture there of
Yeah,
a tarp.
and old
That holds
tires. Like a lot of
pools?
people use old tires to hold tarps down. Those
Terrible.
they're awful because it's
Terrible,
hard to
yeah.
get standing water out of old tires, and they say, well, drill holes in them or
Right.
cut them in half, and
Use a rock, I say.
you can. Yeah, use a rock is right, and get rid of your standing.
But
Get rid of your old tires.
what I guess what I'm trying to say, the point I'm trying to make too, is that if you're a horse owner and you have all these objects, because we have so many things out there, we have jumps and we have all kinds of things for the horses.
Yeah.
Do the best you can and be as detailed as you can in trying to get rid
Yep.
of that, because one little pool of water could breed many, many mosquitoes,
It can.
and that could raise the exposure rather than lower the exposure, which we're trying to do. And sometimes these things that we do routinely and we see every single day, we don't stop to think
Absolutely.
that maybe that might be a place where mosquitoes might breed.
Yeah.
There was a reason. Oh, well, we're talking about lowering the exposure. So I think there's a lot of things that you can do. And let me ask you one question. I talked to a horse owner recently, and they vaccinate their horses. She has a small boarding facility, and they vaccinate their horses every year. I don't know if they do it after April 1st, but they vaccinate. That's all that they do. They don't spray, they don't shelter the horses. What would you say, just in terms of your advice to people, to horse owners, as far as encephalitis or any disease? Um, in the summertime, should you do anything to protect your horses or anything else to help your horses um, from the mosquitoes and the diseases that they have, or the infections that they could probably possibly give you, or all the problems that they could cause besides vaccinating? Is
Sure.
vaccinating enough?
No, probably not. Um, but I think just from the point of putting insect-borne diseases aside, I just think just be nice to your horse. I mean,
That's a good way of putting it.
make them more comfortable.
Yes.
Insects bother them like they
Do they
bother
not?
us.
Yeah,
And
it's
so,
basically very similar,
yeah,
right?
I think
And
it's
can we say here, and I think you'd be a very good person to talk about this with, is that a horse's skin is very similar to human skin. A lot of people might think that a mosquito can't get through the fur,
a mosquito
but
can.
a
Yep,
mosquito can get through the
yep,
fur and can get into the skin and cause these diseases. So the fur isn't enough, the tail swishing isn't enough, the mane on one side
not enough.
isn't enough.
Right.
So you have to put yourself in your horse's place if you can, and realize that when you get bitten by a mosquito and you've got itching, the horse is experiencing the same thing. And if they had 20 mosquitoes
Yeah.
on their belly, that might be uncomfortable. Plus, there could be other diseases that we don't know about.
Yeah.
So I think that's a very good thing that you said, to take good care of your horse.
I think, if you made me make a list of priorities,
Okay.
at the top would be vaccinating.
Yes.
It's simple, it's
Mm-hmm.
inexpensive,
Mm-hmm.
and it's effective.
Yep.
So that would be at the top of the list.
Yes.
Then just work your way down.
Yes.
Eliminate standing water, use blankets like you show there, manage the time of day if you can.
Yeah.
I mean, some people can't. Some people don't have screened off stables, so
Right.
they can't do anything about that.
But you can buy screening material, and
You
you
could
can put, it
you can
takes a
definitely
little bit.
you
There's
can
a
do
lot
it.
of things you can do.
There are.
I don't know if we can see that picture again, but there's a
Yep.
stall there, and it's got screens. And
Yeah.
we have screens in our homes,
Sure.
right, to try to keep all these bugs out. So the screens help. They're not 100% effective
Right.
because they can still get in. Once they get in,
Right.
you have to get them out.
Right.
So, I mean, actually owning a horse and having horses is very not difficult, but you have to do a lot of work.
You do.
And you can get into a routine. It can be easy, and then you got to change the routine because something happened and
Right.
something didn't work. But there are things you can do, like screening your windows, controlling the amount of water, spraying. But the dusk and dawn is very important,
It
I
is.
think, and it's very helpful because that's when.
That's when a lot of the mosquitoes are out.
Okay.
Some species, not all
Okay.
of them, but there are some species of mosquitoes that are out all day. So
Yeah.
here again, if we've got 48 varieties of mosquitoes in Maine, there's going to be a lot of variation during which each species is active.
Okay.
Generally, it's dusk and dawn.
Okay. Now tell me, what's the definition of dusk and dawn? When it starts getting dark out, does that mean that it's dusk, or is it a couple of hours before that?
Not a couple of hours before. I always think about my own experience is with fishing and coaching. I used to be a soccer coach,
Okay.
and
So you're exposed.
so when I was a coach, I used to have practice late in the day because I had a full-time job,
Yep.
and so I would practice at this field that used to be a swamp. So there was
Oh,
still swamp around
boy.
it.
Yeah.
And so the mosquitoes, I mean, we wouldn't practice after dark, but once we got to the point where it started to get within about a half hour of sunset, and then right around sunset, that's when the mosquitoes were most active, not 2 hours before.
Okay.
And then after the sunset, those mosquitoes would become less active.
Where do they go?
They just go into the leaf litter
Oh, okay.
or on the tree branches.
Okay.
They just go to be protected. I go
Okay.
fishing a lot here lately, especially at the beach in Old Orchard, and the times when those mosquitoes come out are and I usually go in the early morning, is just before dawn.
Okay.
So it's not when the sun's coming up. It's
Okay.
usually about 45 minutes to a half hour before dawn. And it's
Okay.
light, the sky is light, but the
Okay.
mosquitoes will come out for about 15 or 20 minutes and they'll bother you. And then
Mm-hmm.
once the sun comes up,
Comes up,
they're
then the,
gone.
then the flies come out,
Yeah, then the
right?
greenheads
Because they
come out.
take
Yeah,
time.
yeah.
They have a
So
different time.
and I know that Kathy covered that, so that's good. I don't have to cover flies or other
But they're out
mosquitoes.
there and they don't stop, and
They
we're never
don't.
going to get rid of it. No.
They don't. So it's generally within about a half hour.
Yeah. Well, that's good to know.
Just before or after sunset, and a half hour, I would say, before dawn.
Okay. So if you're a horse owner and you have a horse, maybe if you remember or if you're aware of that, you can get yourself into a routine or have somebody help you. Hopefully everybody
Yeah.
that has horses out there has some help
Yeah.
and can do that, because that really helps your animals.
Yeah.
And also something that Kathy Murray brought up, because I was curious, I didn't know, I wanted exactly the temperature. I want the numbers that when we can be safe. But she said, she gave me a lot of help there, and she said
Good.
when it's about 50,
Yeah.
you can feel,
Less active.
yeah, so it's a little safer then.
Yeah.
Than,
So that would have been this morning. It was like in the mid 40s this morning, and but then it warmed up.
that's right. So you
When
have
I
to,
came here, it was in the mid 50s.
yeah.
So there, but anyway.
Yeah, and,
Yeah.
and the one other thing that I really want to touch upon, if you suspect, if you see your horse and your horse isn't acting well, because the neurological signs don't come on right away, right?
don't.
But you want to keep an eye, a real close eye on your horse, but you really don't hesitate to call your vet, because that's what you guys are there for,
Yeah.
to help us, to take the temperature. Right, because there's one of the differences is this, between colic and this particular disease, is that they may not have a temperature when they have colic,
Right.
but they will have a
They
temperature.
can.
They
Right.
can have a
Yeah, they
temperature.
can. I mean,
Okay.
you might miss it because
Okay.
they might have already had the fever and you might miss it, but they do. They can get a fever with this. So yes, I mean, it's good to be very observant, and if you notice anything unusual, especially stumbling, severe depression, circling, that type of behavior, it's very important to call your veterinarian. And here again, I have to go back to rabies too,
Right.
because we haven't had, in my experience in Maine, I think I only remember one or two horses with rabies.
Mhm.
But they can be an extremely dangerous animal
Mhm.
once they go into the furious phase of rabies, which is the kind of the end stages. And so it's important
Right.
for people who suspect or see their horses showing central nervous system signs, such as we described,
Mhm.
to talk to their veterinarian, because
Right.
you really do want to get on top of it quickly.
Well, we want to like make that call and say, please come as soon as possible,
Yeah.
right?
And we do have a really good crew of equine veterinarians in this state
Right.
who are spread out pretty much in the state. I mean, particularly in southern Maine,
Mhm.
I don't think we have a real shortage of equine veterinarians. There may be some areas like Washington County,
Yeah.
and where we might not have a veterinarian that available, but people can get a veterinarian if they need one
Sure.
for their horse. I mean, they're definitely there, and there are some outstanding equine veterinarians in
Yeah.
this state.
A lot of horse owners, including myself, sometimes if we see our horse not acting well, we think, well, we'll wait a little bit of time and see. I had one of my horses colic recently. If I had waited a little bit of time, it would have been a much worse situation. So if a horse has Eastern EEE, triple E, before those neurological signs come into play, wouldn't it be better for the vet to be there to diagnose it before that stage came about? Is it possible? I mean, and I have to say, a lot of times, including myself, we're always thinking, oh, geez, how much is this going to cost? Because not only do you care about your horse and you want to help your horse, but you know it's going to come at a price. And as a horse owner, you have to be prepared to take care of your horse.
Yeah.
So it is a good thing to probably call your vet rather sooner than later.
Yeah, it's a judgment call. I mean, oftentimes the early signs of triple E are very subtle, and they
Hmm.
could be confused with other things
Something
like mild
else.
colic. And so, I mean, I don't think it's a bad thing to wait a little while
A little while. How
before you
long?
call. It here again, there's no hard and fast
Yeah.
rules on
Well,
it,
every horse is different
but you
too.
know your horse,
Yeah.
and I think that people who know their horse would know when to call. But
Yeah.
I'm not saying that you should call, if your horse doesn't eat it, doesn't finish its grain or
Mhm.
one feeding, and
Mhm. Not panic.
yeah, just don't panic is a good policy, because especially if your horse is up to date on their triple E vaccination,
Right.
then you're probably not going to have to worry too much about that. Like as you said earlier, um, and I said earlier, not all vaccines are 100%, but I
Mhm.
think it would give you
Peace of
some
mind.
peace of mind that if your horse is up to date, then it's probably not going to be AAA.
Okay. So I don't know if we still have that picture of the horses with the blankets on, because that picture showed horses that, well, there's a mosquito picture again. um,
He'll
but
get to it.
that picture, that last picture that I had up there, was to show that the horses had blankets on because
Yeah,
it's
because
winter.
yeah,
And that means then you can probably relax and
yes,
not worry at least about that
I
particular
think we
problem.
can relax in winter with
Yeah.
mosquitoes.
Yeah. So thank you so much. I hope that we've answered a lot of questions
Sure.
and help people understand and know what to do. And, the other thing I want to mention, a lot of times I'll call my vet. I have a great relationship with my vet,
Good.
and I call her and I say, this is what's happening, and she'll tell me what to do over the phone
Sure.
before she comes. And a
Sure.
good vet will always do
They
that.
will.
And so, thank you so much again
You're
for
welcome.
coming.
Sure.
And I'm your host, Gabriella, again, here to tell you to please enjoy your horse, care for your horse, and keep your horse. And we'll see you next time.